Why is advanced maternal age considered 35? In this video, we're going to go through why 35 is a quote-unquote geriatric pregnancy. Is it actually geriatric, and what does it actually mean? I have so many patients that come to my office concerned because they just found out they're pregnant, they're 35, 36, 37 years old, and they're wondering how is this going to affect their pregnancy? To understand why 35 is considered advanced maternal age, you have to understand the history on how that came to be, because I think once you understand the history, it'll make a lot more sense to you, and I actually think the fear behind a quote-unquote geriatric pregnancy will come down a little bit. When you're 35 years old, the risk of genetic disorders such as Down syndrome is about 1 in 250. We now have this fancy test called an NIPT, or free cell DNA, where we could literally take your blood and get the placental cells from the baby that are flowing through your bloodstream, and it'll tell you your risk for things like Down syndrome. A very good test with 99% sensitivity and specificity. Is it perfect? No, it's looking at the placental cells and it's still a screening test. But it's far better than what we had before, which were these tests called the quad screen or sequential screen. What they actually are doesn't really matter for this conversation, but just know we did not have very good testing for that. So like I was saying before, let's say you're 25 years old. Your risk of something like Down syndrome is less than 1 in 1,000. The risk at that time they thought was about 1 in 250. So they made the decision, hey, advanced maternal age is 35, because if the risk of something bad happening from this test is about 1 in 250, so they decided, hey, 35 is advanced maternal age, and they moved on. In reality, that risk to that test is closer to about 1 in 4 to 500. But that is how we got 35 to be advanced maternal age. The question then becomes, if you're pregnant at 35, is your risk actually that high? And if you, for example, did the testing and you were negative, the answer is actually not that much higher. That test that we talked about before, the NIPT, if I told you your risk of Down syndrome before the test was about 1 in 250, and after that test, it was less than 1 in 10,000, if everything looked fine on the ultrasounds, most people would not take the increased, although very small, risk of doing a test like an amniocentesis. As far as the other parts of the pregnancy, they have found a small increased risk with just being pregnant, such as the risk of preeclampsia. But for example, let's say this is your second pregnancy and you're 36 years old, your risk of preeclampsia is actually less than a 25-year-old who's undergoing their first pregnancy. So although the risk is slightly higher, it is not that much higher. The risks actually go up considerably over 40. And over 40, we actually make different screening recommendations, like we do either a NST, which is where we look at the baby on like the monitor, or we do a BPP, which is an ultrasound to check the fluid and breathing motions, etc. at that time. But actually at 35, we don't really make any other delivery recommendations or screening recommendations unless there's another issue. The other reason that we keep 35 as advanced maternal age is to talk about something called ovarian reserve, and it's a good way just to remind us to have this conversation with patients. You're born with, actually, you're conceived with all of your eggs, and actually you lose a lot of your eggs even before you're born, and then you go through puberty, and through that time, every year you lose eggs. At around 30 years old, your total amount of eggs is about 12%, and around 40, it goes down to about 3%. So there's a huge drop. Actually, it's the steepest for most people around 37. So your chance of getting pregnant and having a viable pregnancy as you get older gets smaller, because obviously if there's an increased risk of genetic stuff happening, your chance of miscarriage is higher, and that goes into the conversation of when and how you should get pregnant. So like, for example, if you had a 23-year-old and she came in saying she wanted 6 kids, she has a huge reproductive window ahead of her, right? So that person, you're not going to have much of a conversation about, for example, egg freezing or IVF. Versus if you have like a 34, 35-year-old patient that comes in and she's single and she wants a large family, if you imagine if she magically got pregnant the next year and she was 36, and then let's say every 2 years she magically got pregnant and it was 36, 38, 40, 42. You can see how your chances of getting pregnant are lower, and that is if you got pregnant every other year since deciding to have kids. And you may not reach your reproductive goals if that's what they are. Obviously, if you don't want to have kids, this whole video doesn't make sense for even watching, but for those people who want larger families, it does make a difference. Or let's say you're younger and you don't know when you're going to have kids or want to have kids, it comes into the conversation. And for me, one of the hardest things is seeing someone in their mid-40s They're really nice people who were very career driven, and they never thought about this or took this conversation seriously, or their doctor never talked to them about it. And now they lost their opportunity to have kids because, for example, let's say they're on the worst side of that curve, they're not able to get pregnant. There's other options, obviously, like egg donation and adoption, but my point is that they lost an opportunity that they could have had if they were just counseled appropriately or were able to make that decision when they're younger. So keeping 35 as advanced maternal age is a good way for us and for patients to have something in the back of their mind to just go through what the reproductive goals are and to make sure that you know all of your options on how we can help you. I hope you found this video helpful. If there's anything specific you want me to go through, I'm going to try to make these videos a little more often, and have a good day.